University of Wisconsin Greenbay's vaccination rate among students sits at 60%, just 10% short of a UW system-wide goal. Some already vaccinated students on campus are also waiting to reach.
You know, we want to have a normal college experience, so it would be nice.
Once the campus reaches 70%, students will be eligible for a select number of $7,000 scholarships. In efforts to help get them there, Interim President Tommy Thompson made a stop to encourage the vaccine and help smash COVID.
It's all working out for the ultimate objective, is to get more students vaccinated, keep the place healthy. And that's what we're doing, and I think it's working out very nicely.
UW Green Bay Chancellor is confident the campus will reach that target soon.
We're going to push as hard as we can push, and we do expect that number to keep going, and we're going to hit 70%.
While the campus is still fighting to get students to that 70% vaccination rate, faculty and staff here at the UW-GB campus are almost at 80%. However, Green Bay's student body is not alone. UW Superior, River Falls, Parkside, Platteville, and Stevens Point are among the other UW schools to not yet reach the 70% vaccination rate.
We're hoping to get all of our schools over to 70% through the month of October, and I'm just proud as punch about the kind of collaboration, the kind of competition that's developing amongst the chancellors to get more of their students vaccinated.
The campuses have until October 31st to reach the goal vaccination rate. The deadline was extended by nearly 2 weeks.
So what kind of numbers are you seeing there at Bellin?
Yeah, so we continue to see very high levels of patients getting care in our hospitals. In the Fox Valley in northeastern Wisconsin, which is about a 15-county region, we only really had about 9 to 11 ICU beds out of 300 some total beds. And it's not just a staffing shortage we're having at this point. All the health systems in our region are seeing record number of patients seeking health care, and people are pretty darn sick too. So it's been very, very busy. We seem, though, from the COVID perspective, to maybe hitting the plateau right now. Our growth of hospitalizations is only growing maybe 1% a week compared to 20 to 30% we were talking about a few weeks ago. So we're hoping that that trend will continue, and hopefully we can have a decrease starting there soon.
That would be nice to see. Now, Pfizer submitted research to the FDA about its vaccine for kids. How soon could we see a vaccine for children between 5 and 11? I know some were hoping to have it by Halloween.
Yeah, I think around Halloween probably will be the start. It might be a little bit after. You know, the challenging part is with the Pfizer vaccine, it's a 2-part series, 3 weeks apart. So it's going to take you 5 weeks after your first shot until you are fully protected with that vaccine. So even if we get kids vaccinated by Halloween started, you know, we're going to be looking at Christmas time for when that full protection actually starts taking place.
And how important is it to get that age group vaccinated?
Yeah, this is definitely a key age group at this point. The 5 to 11-year-olds represent about 9% of the population in Wisconsin. So if they're anything like the other kids just a little bit older than them, we expect about half that group will get vaccinated, and probably relatively quickly. And that 4.5 or so extra percent of Wisconsinites vaccinated really is going to be impactful to the risk that COVID comes back in our community once we get over this peak that we're seeing right now. And it's just going to continue to help protect us and keep COVID hopefully away from us in the future.
And let's talk about the booster shots. When is the best time to get it? For those who are eligible, should they be getting it right now?
Right, so we're looking for 6 months after your second dose. I just got my third Pfizer vaccine Tuesday evening at the Fast Care at Meyer, and it was a really easy process to do. So, you know, anytime you're 6 months or after, you can consider getting that booster shot if you're in one of those eligible groups. But we really strongly recommend it for people who are 65 or older, or maybe have a pre-existing condition that makes them a little bit higher risk to get really sick if they do get COVID.
Can people mix and match their vaccines?
You know, you actually can mix them, but it's challenging to do so because it's strongly recommended to stay with the same vaccine you've had previously. So that's going to be your easiest bet, is just to stay with what you have already received. But, you know, from a scientific or medical perspective, you could, if you needed to, mix your vaccines.
Meaning you could get a Pfizer booster if you had a Moderna first and second dose?
You could from a medical perspective, but most places that give the vaccines are going to ask that you wait until we get guidance from the FDA and the CDC on Moderna.
On a related topic, how soon do you expect boosters to be approved for Moderna and Johnson & Johnson?
So when we were back last winter, Moderna was a few weeks after the Pfizer vaccine was approved. So, it's probably weeks to months away before we get that guidance on what to do with Moderna and Johnson & Johnson. Some recent studies put out by the CDC have shown that the Moderna vaccine actually seems to have the highest degree of effectiveness for keeping people out of the hospital. So maybe it's a little less important for people who've received the Moderna vaccine to go out and get a booster shot. But that data and science is still being studied now that millions and billions of people really have been vaccinated. So we're just asking people to hold tight if you have been vaccinated previously with Moderna or the Johnson & Johnson.
Do you think, Doctor, that we'll have to complete this vaccine series every year going forward, dose 1, 2, and then the booster?
I think it'd be very, very unlikely that people need to get all 3 shots annually. Potentially, we would be looking at a booster shot, maybe once a year, or, that duration really needs to be further investigated. It's likely that 3 doses may be enough for most people, that they don't need any boosters going into the future. So, that data will come out with time. We don't want to get the cart in front of the horse. But we will continue to look at this, and, hopefully COVID just sort of dwindles away like many past pandemics that have impacted the world. And we won't have to worry quite as much about booster shots.
The CDC has just issued an urgent recommendation for pregnant women and those who have recently given birth to get vaccinated. What do you say to women who are hesitant to get the shot?
Yeah, I totally understand being hesitant, particularly when you're worrying about one of your kids. But, we see people who get pretty darn sick with COVID and they're pregnant or recently delivered a child. And at this point, the vaccine has been well studied in this group and has continued to demonstrate safety. It does not impact fertility, and it does not impact the development of your growing baby. So clearly, the benefits of vaccination outweigh the risks of vaccination in this age group.
Earlier in our conversation, you talked about a peak. How many more waves or surges of COVID could we see in the near future?
I wish I knew how many more peaks or surges we were going to see in the future. I think the important part here is the more people that we can get vaccinated, the less likely it is that we're going to see peaks. And if we do see peaks, it's going to be a much smaller peak than previously. This was recently studied by some mathematicians and scientists who indicated that for every 1% more people that we can vaccinate, that the impact it has on our economy and people missing work due to being sick and healthcare costs is measured in the billions of dollars. So every percent can make a huge difference and protect us all in our entire community.
Mishicot High School in the news this week. They switched to virtual learning because of a rise in cases. Do you expect to see more schools having to go virtual at some point?
Yeah, I've heard of a bunch of different schools across the state that have had to go virtual now for a period of time. We highly recommend that people wear masks in schools. If we can have everyone wear masks, we know that kids are going to be less likely to need to go virtual. There's going to be less outbreaks. This was actually studied recently in Arizona, and they compared schools that had masking requirements to those that didn't. And they found that schools that did not were 3.5 times more likely to have outbreaks in their school of COVID-19. So, this is highly suggestive and important that we need to have kids masks in school so we can avoid this. There's little to essentially no risk of masking in schools. Most kids are highly compliant with it if asked to do so. And it can have an important impact on keeping our kids in school, which is our primary goal. And then also, when kids get infected, that can spill over to the rest of their family, where then you have family members who are missing work. And for a lot of people, they rely on that paycheck.
And we're also seeing kids with cases of the flu and RSV and others. What kind of numbers are you seeing when it comes to flu and RSV?
We see a lot of RSV right now, which is most impactful to kids probably less than a year to, really less than 6 months. Adults too can get RSV. Typically, it doesn't give them really significant symptoms at all, maybe just some congestion or other cold-like symptoms. And sometimes older people can have a bit of impact by RSV. We also see two other viruses floating around right now. One is rhinovirus, the other is parainfluenza virus. And these are both other causes of something like a common cold. Influenza is interesting. So far, we really have not seen this. I think last week, the state had indicated 8,000 flu tests were done in Wisconsin, and 0 of them were positive. So we haven't really seen a flu season creep up to us quite yet.
And Doctor, I want to ask you about Halloween. It'll be here at the end of October in just a month now. What tips do you have for families who plan to go trick-or-treating?
You know, I think people probably already know this, but if you can mask if you're going to be within 6 feet of other people that aren't in your primary household, if you can try to distance from people that you don't live with, wash your hands, and then don't go out if you're sick. And then, of course, the two other important things are if you're eligible for vaccination, it's important to do that. And then, flu shot season is upon us. I got my flu shot last week as well. And we really encourage people to get that done soon. Ideally before Halloween, I think would be a good time. So with your trick-or-treating, consider getting your influenza vaccine done as well.